Good morning once again. Thank you for tuning in to Choices Now TV. And I'm just going to be with you very briefly once again. Today we're going to be talking about Medicare. Medicare. Now, a lot of this information, the people that visit this site, you already have the information. But we're going to just go over it because a lot of times we have the information and we just don't give it out. We have it all and we don't care to share it for whatever reason. So what I'm here to do this morning is just, provide a little information, and it's information that's out there, information that you certainly can find on your own. And I'm going to give you the websites because there's nothing that, why reinvent the wheel? It's already been made. So I'm not going to reinvent anything. I'm just going to provide you with the information. And as I said last week, we're going to hit it and quit it. So we're going to talk about Medicare and at what age we get started with Medicare or when we should sign up. So let me just say thank you for tuning in to Choices Now TV. I'm really excited about the content that I'm preparing to bring to you right now. It's a little on the serious side, just giving out some relevant information that we as individuals, we need to have this information. And if we have it, we could help someone else that may not have access to the internet, that may not have access to going out and getting these resources in place. And if we have this information, certainly we can be a help to someone else that may need our assistance. So that's what I'm about this morning. So once again, thank you for tuning in to Choices Now TV. Now let's get right into this. So I'm using the site medicare.gov. I'm going straight to the site. Our government site has set it up, and there, all your information, you just have to navigate, go around, and, just kind of gather the information that you're looking for. So certainly you want to make sure that you visit the site. It's medicare.gov, medicare.gov. Okay. Now, at what age do you or should you start applying for your Medicare? Okay, well, Medicare is usually 3 months before you're 65 years old. So before you turn 65, it's like 3 months before that time. Now, once you apply for your Medicare benefits, after you've done that, then you want to start, you want to go and apply for your Social Security benefits. And that's going to be at your, it's ssa.gov. Okay, ssa.gov. Now, also, you can apply online. You can also go to your local office, or there's a 1-800 number. That's 1-800-772-1213. And once again, your local office. There is a number for those that are hearing impaired that they can go and get this information as well. We're going to get that for you. But I'll certainly provide that. So for the TTTY service is what it's called. That's for those that are hearing impaired. That number is 1-800-325-0778. 1-800-325-0778. Okay. So certainly you want to, once you apply for your Medicare, once again, that's 3 months before you turn 65. Then you want to go ahead and apply for your, start getting your Social Security benefits in place, as also the Railroad Retirement Board. If you have those type benefits, you want to go ahead and start at that time doing that as well. And that number for the railroad benefits is 1-877-772-5772. Okay, so if you know someone that worked in that industry and they just kind of maybe they should have this information. They have the information already, but then it's just something else that if you're trying to help someone out, you want to look at all these different benefits that they may have access to, that they can gain access to reap the benefits, so you can kind of guide them in that direction. So once again, 3 months before you're 65, you want to start your Medicare process. And when you go to the site medicare.gov, there's like a calculator. You can input your information and it'll kind of guide you as to when to apply. Okay, you may want to make a little note. You know, we have our smartphones, we have all these different devices that we put, you know, that we have. But sometimes we're so busy and we forget to do these type things. And when we forget, we may do it a couple of months later. We may do it a year later because we're working. You know, we have a lot going on. We take care of the grandkids. We're doing whatever, and we just put our stuff on the back burner. But there is a cost. There are penalties when you don't sign up on time. Okay, there are definitely penalties for signing up late. So let's talk about Part A, B. We're going to talk about C and D. So Part A, this covers your inpatient care. Okay, Part A covers your inpatient care. So, you know, and this is through Medicare. Okay, this is Medicare, your original Medicare. So days 1 through 60, there's no, you pay nothing, no deductible. Days 61 through 90, there's a fee. Day 91 through 150, there's another fee. Now, I'm not giving you those fees because the information that I have is for 2022. Now, as each year goes along, you know, those changes, those fees will fluctuate. But usually the first 60 days, it's no deductible. But after that, they can fluctuate over the years, you know, as time goes on. All right, so now we're going to hit Medicare. Well, the Part B. Now, this is usually for your doctor's office visits, and that's 20% of Medicare covered services. Now, what those services are, you go to the site and they can kind of give you that information as well. What I'm doing today is just giving you a brief synopsis of, you know, what's available out there and how to go about getting it. Okay, you just go right to the site. And once again, that will cover 20% of your visits. All right, now, here are the penalties if you don't sign up on time. You'll pay an extra 10% for each year you could have signed up for Part B, but you didn't. Let's not give away anything. So you're going to pay an extra 10% for each year that you could have signed up, but you did not sign up. Like I said, we get so busy. We get busy doing different things, and we fail to handle our business. It's life. It's life. Things go on. You know, things are happening. So we just get tied up and caught up in doing whatever, and we just, you know, we don't think about it until later on. Hopefully that's not you. Hopefully that's not me, you know. Also, this premium, okay, the penalty for premium B, you're going to pay a higher premium depending on your income. So depending on your income, depending on, you know, you may have been making $50,000 a year, $100,000 a year, $30,000 a year. So depending on how much you were making, that will determine what your fees are going to be per month. Okay? Now, this is not just a one-time late fee. You're going to pay this penalty as long as you have a Part B in place. Okay? As long as you have it in place. Now, let me just say, if you sign up for Part B, okay, you have to sign up for Part B in order to buy Part A. So you can't have one without the other. So if you want the inpatient care, you got to sign up for Part B. Okay, and Part B is just your office visits and things like that. So you sign up for Part B, you have to buy Part A. Okay? You have to sign up for Part B to buy Part A. So you get your regular, you know, your doctor's office visits and things like that covered. Then you can sign up for the hospital coverage. All right. So make sure that you note that. And keep in mind, once again, you want to sign up on time, because if you don't, there's going to be that 10% each year that you fail to do that. Okay. Now, also, you generally won't have to pay a penalty if you qualify for a special enrollment period. Special enrollment period. Not going to get into what that period is, but a special enrollment period. Now, to qualify, you or your spouse must still be working, and you must have health coverage based on that job. So say, for instance, or my husband is working, we're at that age, but he continues to work. So because he has coverage, and we don't necessarily have to sign up for that because we have coverage. We have the hospitalization, we have we have everything we need to cover our medical costs. But this is if you're without that, and you say you've retired, you're not working, so you don't have any coverage. You got to depend on this medicare.gov. You got to depend on the Medicare benefits. So sign up on time to make sure that you don't have any penalties that's going to take away from the Social Security that you're going to get, if it's still available by that time. They say that our Social Security benefits are running out. They're running out. Okay, and once again, Part B is going to cover 20% of the cost of Medicare covered services, and that's after you've paid your deductible. Okay, now I'm going to skip over Part C right quick and just go right to Part D. And Part D that's your prescription drug plan. All right, your prescription drug plan. Now, let me say this, because this is most important. A lot of people have problems or trouble with paying for their prescription drugs. The cost is astronomical. There are a lot of other benefits out there that you can get apart from this. So say you have this in place and it's still very costly. I had a card one time that I passed on to my daughter. I think it's GoodRx or something like that, and they give you discounts. I don't know everything that's behind it. I picked it up at a doctor's office that I visited, and she saved quite a bit. So this, when you get your prescription drugs, most plans charge a deductible, an amount you pay before the plan starts to pay. Okay, for prescriptions you fill. The deductible amount varies based on which plan you choose. Okay, the actual costs vary depending on the medicines you take. Now, if they are on your plan's list of covered drugs and which pharmacy you use. So there's some things that, you have to kind of follow the guidelines. Depends on your pharmacy, depending on the plan's drug, the list that they cover drugs on their list. So it's a lot of different things that you're looking at. So let's talk about the penalties. Okay, let's talk about the penalties. Okay, now, when you go to the site, when you go to medicare.gov and you're looking around the site, it will say, there's a little area where you can click on and let you know who pays extra amount because of the income. Right? So once you're at the site, take your time, just take some time, navigate. And if you're not at that age yet, it's never too early to find out the information. At least you'll have it. So when you reach that age, it's not you're not overwhelmed by what has to be done, the information that's out there. You're pretty much aware or familiar with it, should I say. Okay? Now, you might pay a penalty if you don't join Medicare drug plan when you first get Medicare. So when you first get Medicare, you really want to sign up for Part D. Now, if you go 63 days or more without credible drug coverage that's similar in value to Part D. Okay, so there again, when I mentioned about if your spouse was still working and you have those benefits in place, you're not going to be charged a penalty because you had coverage, that credible drug coverage. And most jobs, they have credible drug coverage, because they that's part of the benefit package for their employees. Now, the penalty, this is the penalty for not having Part D. You're going to pay an extra 1% each month. 1% each month. That's 12% a year. Now, that's a lot. That's a lot. Now, that's if you have Part D. That's if you could have signed up, but you didn't. The penalty is added to your monthly premium. It's not a one-time fee. It's not a one-time late fee. Let me say it again. It's not a one-time late fee. Now, you're going to pay this penalty each month as long as you have Part D coverage. Even if you change plans, you're going to continue to pay that. Now, if you have credible drug coverage, or if you qualify for extra help, you won't have to pay a penalty. So there is a way out. There's a way out, okay? And they're going to, once you go to the site, it'll give you some examples of the Part D penalty. Once again, you already have this information. I know you do. But like I said, somebody that you may know, they may not have it. They may not have access to the internet. They for whatever reason, there's a lot of people that are in need, that need help. And if you have that information, why not give it out? Why not give it out? So lastly, we're going to hit on Part C. Now, Part C, that is, or should I say, that's going to be your Advantage plans, your Medicare Advantage plans. Now, this is a monthly premium based on which plan you join. There's a lot of plans out there. I'm not going to get into the plans, but if you type in Medicare Advantage plans, it's going to pull up a list. It's going to put up a list, Whenever there's open enrollment, they're going to start sending out all these bulletins. They're going to, it's just a lot of information. Also, medicare.gov will send you each time it's time to renew, each year, they're going to send you out a booklet. And in that book, it's going to have a list of Advantage plans that you can choose. And you go through that and you determine which one's going to be a good fit for you. Okay, so take your time, go over that. It's broken down by your county. It kind of tells you the price range, give or take, deductibles, just some general information. So certainly you want to watch out for that booklet that's going to come from our government, medicare.gov, huge book. And it's just general information. So you can do some comparisons when it's time to, if you're looking to change your Advantage plan, if you want to go back to traditional Medicare, that information will be in there. And that's something that you're going to have to decide. Okay. So this is it's going to you must keep paying your Part B premium to stay in the plan. Deductibles, coinsurance, and co-payments, they're going to vary based on your plan. And plans also have a yearly limit on what you pay out of pocket. Now, once you pay your plan's limit, the plan pays 100%. For covered services, for covered health services, that for the rest of that year. Also, there's a Medigap, Medicare supplement insurance that you can look into. It's based on which policy that you have. Also, once again, you must keep paying your Part B premiums. Also, helps to lower your cost of Part A and B services in Original Medicare. That's the Medicare supplement insurance. Some Medicare Gap policies include extra benefits to lower your costs, like coverage when you travel outside of the country. So for those that love to travel abroad and something happens, you still have coverage if you get your Medigap insurance. Okay, so now that's all I wanted to hit on today concerning Medicare. Let me just mention AARP. I guess you say, oh, she's stuck on AARP. AARP has some benefits. So in order to be a part of AARP, you have to be 50 years or older. And it stands for American Association of Retired People. Well, I'm not retired. Okay, you may not be retired, but at 50, you can start reaping some of those benefits. And some of those benefits, which I always forget to present my card when I'm renting a car, when I'm going out to Denny's. There's a couple of places that will honor your AARP card. It gives you a little discount. Renting your hotels, if you're a Hilton person, they won't do both. They'll do either Hilton or they'll do the AARP. Why they do it like that, I don't know. They don't really want to give us a break. Nevertheless. And so AARP, at their site, and their site is aarp.org, aarp.org. Go there, look around. It's just a lot of information. Not saying to sign up for anything, just get the information that's out there. It's free information. Now, they have their things in place. They talk about different insurances. They talk about, supplements. They use United Healthcare, but it's so much out there. So once again, I am not, I am not saying go here and sign up for this. What I'm saying is go and get the information, look around, do your due diligence, find out the information, and then, begin to search around for what's going to best suit you. Okay. So that's all I have for you today. Thank you so much. This did go a little long. I try to keep these videos, I want to keep them right at about 15 minutes. But if you stayed with me until the end, I appreciate that. Once again, this is Choices Now TV. And until next time, it's been my pleasure. Have a wonderful day.